Have you ever heard of CRISPR? It sounds like something out of a science fiction movie, but it's a real technology that's changing the world as we speak. Imagine being able to edit life itself, like a document on your computer. That's CRISPR, a revolutionary gene editing tool that's poised to transform medicine by 2026. So, what exactly is it? Think of it as a pair of molecular scissors. Our DNA is like a huge instruction book that tells our bodies how to grow and function. Sometimes there are typos in this book, genetic mutations that cause diseases like cystic fibrosis, sickle cell anemia, or Huntington's disease. CRISPR can go into our cells, find that specific typo, and correct it. It's incredibly precise and much faster and cheaper than older methods. This isn't just theory anymore. It's happening in labs right now, with early clinical trials showing amazing promise. Let's talk about the incredible potential. For the first time in history, we have a real shot at curing genetic diseases, not just managing their symptoms. Imagine a world where children born with inherited disorders could live full, healthy lives. Beyond inherited diseases, CRISPR could revolutionize cancer treatment. Scientists are working on editing a patient's own immune cells, turning them into superpowered cancer fighters that can seek out and destroy tumors. We're also looking at fighting viruses like HIV by literally cutting the virus sDNA out of an infected person as cells. The possibilities are staggering, from developing drought-resistant crops to combating aging itself. But with great power comes great responsibility, and this is where things get complicated. The ability to edit our genes raises some profound ethical questions that we need to talk about. The biggest debate is about germline editing. This means making changes to sperm, eggs, or embryos. These changes wouldn't just affect one person. They would be passed down to all their future generations. While this could permanently eradicate a hereditary disease from a family line, it also opens the door to what people call designer babies. Where do we draw the line? Is it okay to correct a gene for a life-threatening disease? Most would say yes. But what about enhancing traits like intelligence, height, or athletic ability? This could create a genetic divide in society, a world of the genetically enhanced and the unenhanced. Who gets access to this technology? If it's expensive, will it only be available to the wealthy, further widening the gap between the rich and the poor? These aren't easy questions, and different countries and cultures have very different views on where to set the boundaries. Looking ahead to 2026 and beyond, the science is moving at lightning speed. Researchers are developing even more precise versions of CRISPR, reducing the risk of off-target effects, which is when the molecular scissors cut the wrong part of the DNA. We're on the verge of seeing the first CRISPR-based therapies approved for widespread use. These initial treatments will likely focus on diseases caused by a single gene mutation. The first approved CRISPR therapy for sickle cell disease is already a reality, changing patients' lives. But the real revolution will be when we can tackle more complex diseases like heart disease, Alzheimer's, and diabetes, which are caused by a combination of many genes and lifestyle factors. It's a huge scientific puzzle, but we're getting closer to solving it. By 2026, I'll have a much clearer picture of what's possible and what's safe. We'll all also see a global conversation about regulations and guidelines to ensure this technology is used ethically and for the good of all humanity. CRISPR is more than just a scientific breakthrough. It is a technology that forces us to ask fundamental questions about who we are and what kind of future we want to build. The journey is just beginning. It's an exciting and slightly scary time to be alive. What are your thoughts on gene editing? Let me know in the comments below. Thanks for watching, and don't forget to like and subscribe for more deep dives into the future of science.